So my name is Rebecca Jacobs. I'm a public health nurse here with the program. Karen Vian will also be talking on these slides. And a couple of things before we get started. This will be recorded so that people can access it later. Your photos won't be, it'll just be like a webinar form. Go ahead and put in the chat your name, school-based health center, and your role so that everybody can see who's here. And Kate O'Donnell will be managing the chat. So if you have questions, go ahead and put them in the chat. And then we have time for questions throughout. You can go ahead and unmute and ask questions during those times. So thanks for being here so early on a Thursday morning. We'll go ahead and get started. So, and then I'm going to be, Kwong is running the slide, so you're going to hear me say next slide numerous times. So next slide, please. Okay, so the orientation topics that we have today are sort of an overview of the Adolescent School Health Unit, Oregon School-Based Health Centers, State School-Based Health Center funding, standards for certification, data requirements, youth-centered SBHCs, youth involvement, and resources. Okay, next slide. So first, we want to orient you a little to our office. The state program office sits in the Adolescent and School Health Unit, which is part of the Oregon Health Authority's Public Health Division. Other programs in the Adolescent School Health unit or section include the School Nurse Consultant, a School Nursing Pilot Program, Youth Sexual Health Program, Policy and Assessment, and House Bill 2591, which includes School Health Service Planning Grants, Mobile School Linked Health Center Program, School Linked Telehealth Pilot Program, and COVID-19 School-Based Recovery Program. Okay, next slide. So in total, the Adolescent School Health Unit is a group of about 16 individuals that work to support all youth and adolescents in Oregon. Our vision is that Oregon is the very best place for youth to learn, grow, and thrive. And our mission is to support the health of all youth in Oregon through evidence-based and data-driven policies, practices, and programs. Next slide. The SBHC Program Office, or SPO. So I call it SPO and Karen calls it SPO. So you'll hear both of those things throughout the webinar. Is a total of 9 employees. The main functions of our state program office include certification. We work to ensure and monitor compliance of the state standards for certification, technical assistance to sites, policy and program development, data collection and analysis, and funding. Next slide. So let's move on to talk about school-based health centers. Here are some of the photos of SBHCs around Oregon. As you can see, they look very different depending on community and capacity. SBHCs are a unique care model for comprehensive physical, behavioral, and oral health services provided to youth on school grounds. The idea being that less class time will be missed and youth remain healthy and ready to learn and thrive in the classroom and beyond. SBHCs are also unique in that they provide population-based, youth-centered care that follows comprehensive best practice guidelines. Next slide. Some of the unique characteristics of SBHCs are that they are integrated in the school, built on partnerships, youth-centered and convenient for students and parents, and accessible and effective. Next slide. SBHCs are built on what the National School-Based Health Alliance recognizes as the core competencies. There are 7 core competencies of an SBHC that represent knowledge, expertise, policies, practices, and attributes that every SBHC is expected to demonstrate in its pursuit of student wellness. Those 7 core competencies are access, student focus, school integration, accountability, school wellness, systems coordination, and sustainability. And then you can find more in-depth information on their website listed here on this slide. Next slide. In numerous nationwide studies, SBHCs have been shown to improve health-related outcomes. Use of SBHCs is associated with increased use of vaccination and preventative services, reduced asthma morbidity, fewer emergency department visits and hospital admissions, higher contraceptive use among females, improved prenatal care and higher birth weights, lower illegal substance use and alcohol consumption, and reduced violence. And next slide. Studies have also conclusively linked SBHCs to improved educational outcomes, including a reduction in rates of school suspension, higher high school completion, increases in grade point averages, and increases in grade promotions. Next. So as of July 2021, we have 78 certified SBHCs across 25 Oregon counties. And we anticipate approximately 8 new certified SBHCs will be opening in the next month. We tried to get that number a little closer. It might be one less, but that's about what we have. Next slide. Of the 78 certified SBHCs, 76% are sponsored by FQHCs, 47 are state recognized as patient-centered primary care homes, 47%, and 67% of SBHCs are located in primary care health professional shortage areas. 11 SBHCs have a dental provider on site, and 97% have a mental health provider on site. Next. As previously mentioned, one of our roles is data collection. The following is a breakdown for the 2019-2020 service year. So for ages 5 through 21, primary care visits comprised 52% of visits, 46% were with behavioral or mental health, and 2% were with a dental provider. Next slide. While the SBHC model was built around a primary care model, the state program office and SBHCs have continued to move toward a more integrated care model. Our current certification standards do not require mental health therapy on site, but 97% of SBHCs do have behavioral health services on site. The structure of behavioral health care varies across sites, and some sites using behavioral health consultants that are embedded in primary care team, while others operate a more traditional outpatient model. SBHC behavioral health staff also play an important role in the school community. Many work closely with school counselors promoting school integration and SBHC referrals. Next slide. So let's talk about funding. There are 3 funding areas we'll talk about: base funding, mental health expansion grant, and additional opportunities. Next slide. All right, so base funds. Counties or medical sponsors with certified SBHCs are eligible for what we call base funding from our program. Each certified SBHC is eligible to receive $60,000 a year in base funding. And base funding is used to support activities related to oversight, maintenance, administration, operation, and delivery of services within the SBHC. Next. The mental health expansion grants were initiated in 2013 from a huge push by the legislature to address unmet mental health needs of children. Our office currently funds 65 SBHCs with capacity grant funding and 25 SBHCs to do youth-led projects. Like base funds, the capacity grants do not cover the full cost of providing mental health services at SBHCs, and sites typically draw off a partnership model to ensure adequate and appropriate services in their SBHC. Our office did not receive additional funding for this biennium, so we currently cannot offer the mental health expansion grant capacity funds to new sites that apply for certification at this time. Please connect directly with Micah Rotman in our office if you have questions about capacity grants or youth-led grants. Next slide. And lastly, the state program office at times has additional funding opportunities depending on the budget. In the past, our office has funded one-time grants to support things like supplies, outreach and engagement, and youth-centered clinics. Next slide. Okay, this is a meaty slide. So here we go. Some basic logistics about the funding from our office. All state SBHC funding comes from the state general fund and it follows a 2-year budget cycle. Local public health authorities, LPHAs, are given the first right of refusal for SBHC contracts with the state. There are basically 3 ways that state funding can flow from our office. In the first example on the left, funding can flow from the state program office directly to the local public health authority. In these cases, LPHAs are the ones operating the clinics. In the middle example, funding can flow from the state program office directly to the LPHA, which then subcontracts with other entities to operate the SBHC. In the example on the right, funding flows from the state program office directly to the medical sponsor. And if the SBHC received mental health expansion grant dollars, that funding also goes through the medical sponsor. If the medical sponsor doesn't provide behavioral health services directly, they must then subcontract with a different entity to provide those services. Next slide. Okay. Any questions? If you have a question, you can go ahead and unmute or put it in the chat. Kate, do we have any questions in there?
Not so far, that nothing that's been unanswered, I don't think.
Okay, great. Give anybody a second here if they want to ask a question. All right, well, you can also ask questions later if you've got them, and then I'm going to turn it over to Karen to talk about certification.
Good morning, everyone. This is Karen Vian. So now we'll talk about the standards for certification. These standards apply to all agencies that work in the school-based health center, including physical health, behavioral health staff, and dental providers. And so as we begin to talk about standards for certification and compliance, this section really needs to be framed around our current climate and that we're in a pandemic. This last school year, we modified and we postponed and canceled certification pieces in response to the pandemic and to the needs of the school-based health center field. The framing this year is we've entered this school year and we've already postponed some deadlines with the operational profile entry requirement to December 1st, and we've postponed site visits. So please know that our office tries to find a balance between compliance as well as the needs of the school-based health center field, as well as maintaining a strong model of school-based health centers in Oregon. Next. So what is certification? Well, the model is outlined in Oregon in what we call the standards of certification, or this booklet that you see on the right. And this is written into Oregon administrative rules. These rules establish the criteria that our office uses to certify, suspend, or decertify school-based health centers. And they establish a clear model and tries to standardize school-based health centers across Oregon. Certification is completely voluntary, and only sites that meet this model are eligible to be state certified and receive funding from our office. Next. So we will now go over some major points about certification to help you better understand the model, but we can't go over all of it. You can definitely find a copy of the standards online on our website to reference. The standards are split into these sections on the slide: certification, sponsoring agency, facility, operations and staffing, pediatric healthcare, data, and billing. And then it's also important to remember that our standards are minimum standards. There's no reason why a certified school-based health center can't operate above and beyond these standards. This is just what is needed to be the minimum in place to receive funding from our office. Next. So I'll go through some of the major points in the standards. So we talk about sponsoring agencies, and what does that mean? A sponsoring agency is someone that provides the school-based health center with, or contracts with someone to provide something like funding, staffing, medical oversight, liability insurance, billing, or space. So for example, a school is a sponsoring agency because they provide space for the clinic. And then you'll also hear the term medical sponsor. And what does that mean? That is someone that provides medical liability coverage, ownership of medical records, and medical oversight. So for example, in Oregon, we have medical sponsors that are health departments, federally qualified health centers, and others. Next. We have someone that we call and fills a role called the School-Based Health Center Site Coordinator. We have some of you on here today. And our office requires everyone to have a designated site coordinator employed. And that person has several responsibilities. First, they serve as our primary contact with our office. They also help keep the school-based health center in compliance. They notify our office when the school-based health center is not in compliance. They prepare for and attend site visits. They make sure that required information is submitted to our office, like data or satisfaction surveys. They keep the operational profile up to date. They attend our meetings, and they forward email communications to others within their school-based health center that they receive from us. Next. Our standards also talk about the required operations and staffing. And what does that say? They say that school-based health centers that are certified must be open and offering clinical services a minimum of 3 days a week when school is in session. Clinics also must be open at least 15 hours a week with the availability of same-day and scheduled appointments. And then also at least one licensed medical provider must be available each day that the school-based health center is open. So those would be licensed providers like doctors, nurse practitioners, PAs, behavioral health individuals. Next slide. This chart is in the standards, and so it's always something good to reference because for me, it makes things a lot easier to read. The minimum staffing is that everyone is required to have someone in a role that's called an office assistant, health assistant, medical assistant, that works 15 hours a week. Everyone needs to have a primary care provider that works 10 hours a week and splitting those days over 2 days a week. And then also have an additional health professional working a minimum of 10 hours a week. So those are the minimum hours required to be certified, and you're more than welcome to have well more than that. Next. What do the standards say about student eligibility? The standards are very clear that all students in the school are eligible for services. Some school-based health centers serve just students, some serve also school staff, some serve other schools in their district, and some school-based health centers even serve the entire community, including adults. Students shall not be turned away from a school-based health center based on insurance status or ability to pay. Many school-based health centers don't collect fees for services, for example, like they don't collect copays. And if fees are collected, students need clear communication and knowledge of a cost. That's very important to prevent creating barriers for students. Next. So the standards are currently right now very primary care focused, and they're based on what we call Bright Futures. This is a nationally recognized standard of care, and Bright Futures is a strength-based approach, and it sets a gold standard for what screenings and services are recommended at each age level.
Hey, Karen, I have a question. Is this a good time or should I wait to the end?
You can ask now.
Okay, so we have a pediatric nurse practitioner in one of our sites, and what that does is limited our ability to see staff. Is this in one of our providers, which happens to be our medical director also, she's interested in hiring more pediatric nurse practitioner to address youth, children and youth more fully, I guess. It's her understanding. But I guess my question is, it looks to me like it's okay to hire pediatric nurse practitioner, but it's preferable to have a FNP rather. Is this correct?
Our standards don't specify what level of
Right.
licensure. There are school-based health centers that hire physicians. There's ones that hire physician assistants, PAs. There's ones that have family nurse practitioners, pediatric nurse practitioners. So it's a wide variety across Oregon. There's no real set who does what.
Okay.
They just need to operate within their scope of practice.
Of course.
Yeah.
Thank you.
Next, please. So these 2 pages are also in our standards booklet, and a lot of it reflects what Bright Futures recommends. So this is the list of the minimal level of comprehensive pediatric healthcare that has to be either available, and it tells you on this chart whether it should be provided on site or by referral. So for example, immunizations are required to be on site. For example, a comprehensive physical exam required to be on site, but something like lead screening and testing could be done by referral. Next. So billing. The standards say that all providers that are eligible must be billing Oregon Health Plan. Everyone that works in the school-based health center should be billing private insurance whenever possible. And then school-based health centers must determine whether their CCO that's in their community can maintain confidentiality with their billing. And so that might be if the CCO can actually suppress EOBs from going home for confidential visits. And if a procedure doesn't exist, then the school-based health center needs to work with the CCO to determine the best way for confidential billing and to make sure there's no disclosure of personal health information or PHI. Next. So the standards are somewhat based on compliance. And so what do they say about being out of compliance? So we ask that anytime someone is out of compliance, that the site coordinator submit a waiver through the operational profile. And the operational profile is an online database that we use to collect information about school-based health centers in Oregon. So a waiver must be submitted to our program within 20 calendar days of any change that brings the school-based health center out of compliance with anything in our standards. So for example, let's say you have a primary care provider that retires November 1st. By November 20th, if you haven't filled that position, if you're out of compliance with the staffing hours in our standards, then you would need to submit a waiver through the operational profile, and then we would approve or deny the waiver within 2 weeks. And the waiver is pretty simple to enter. You enter an explanation of what's out of compliance. It can be 1 sentence, a plan for corrective action, which can be like 1 sentence, and then the date for meeting compliance, which we would hope is a realistic date. And then we work closely, Rebecca and I do, and sometimes if it's a data requirement waiver, Loretta does. We work closely with sites during the waiver process and expect the site coordinator to keep us up to date about progress on the waiver. So touch base on how hiring is going, or if someone needs some technical assistance about some data or whatnot. Next. So the site visits. So when a new school-based health center gets certified, and then every year when people are filling out the operational profile, they're actually attesting or saying that they are meeting standards. In comparison, when we do site visits, we're verifying that people are meeting the standards. Site visits in general occur within a year of a new site opening, and usually a lot sooner. And then every 2 years, basically, for a representative sample of school-based health centers in a system. So, for example, if a medical sponsor runs 8 school-based health centers, we visit 4 in one biennium. So in the like 2021 to 2023 biennium, and then the other 4 in the next biennium way down the road in 2023 to 2025. And our goal with site visits is to support the school-based health center in compliance, but also provide technical assistance. Next. So site visits. This is a picture of the review tool that we use during our site visits. This is available online, and it mirrors almost exactly the certification standards. And so during a site visit, the nurse will fill this out. It's something you can use throughout the year to check your own site and see what you want to work on and improve, or if you're in compliance. In terms of site visits, we're usually on site for most of a day. And at the end of a site visit, we hold a debrief meeting. And the debrief is an opportunity for the school-based health center to talk about the great work they do, provide examples of how they're meeting the standards. And it's an opportunity to ask questions, hear about the site visit findings, and network together with other school-based health center partners that are brought to the table. Next. So after the site visit, the school-based health centers get a site report. This is what it looks like on the right. And it's broken up basically into a narrative section, and then a section that details each action item finding that was determined out of compliance at a site visit. Next. So what do action items look like? So first, I should say that action items, when you get your report, shouldn't come to a surprise to anyone, because they've been discussed at the site visit, both during the site visit, and people have an opportunity to correct things, or they're discussed at the debrief. So each action item is listed, as well as what needs to be submitted to come into compliance. So this usually means that to come into compliance, the site coordinator needs to email either Rebecca or I a photo of some sort of corrected item. So it might be a photo from the lab, it might be a policy that you submit. And the deadline to correct things is usually 30 to 90 days, depending on how much work it takes to correct something. Next. So I just reviewed a lot of the main highlights about certification. Like I said before, there's a lot more detail in the standards themselves to read about. And so how do you know or tell people that you're certified? We send people these plaques when they're first become a school-based health center. And a lot of you probably have seen this hang on the wall in the waiting room or in the clinic somewhere.
So Karen, 2 of my sites, we don't have any more room for to add the stickers to.
So every 2 years, we send out these little metal stickers that you see here, the 2019, 2021. So we just recently last spring sent out the next sticker. And so if you run out of a plaque, room on your plaque, or sometimes we have leftover stickers if somehow a sticker got lost, you can contact Kwong in our office and he can mail you plaques.
Okay, thank you.
Mm-hmm. Next. Okay, and so some last things about certification. This list are things that our office would like to be notified about as soon as possible. So one is if you guys have a new site coordinator. So it's helpful for us to know when that changes, because we can update our email lists and help onboard new site coordinators. We also like to know or need to know about medical sponsor changes, transfers of locations on school grounds, transfers of locations off school grounds to another school. In all those situations, there's a potential that the funding from our office can continue on when a medical sponsor changes or if a school-based health center moves, but there's things that need to be put in place for that to be accomplished. And then we also need to know when school-based health centers close, and then also when they open. And all these are because our program has internal policies and timelines that are not spelled out in the standards that we follow when these type of circumstances occur. Any questions about that certification? Because I'm ready to go on to data, which is also a lot. Okay, you can always put questions in the chat or follow up with Rebecca and I afterwards. Next slide. Okay, so we'll go on to data. So I'm going to go through some high-level data items, and the person to contact in our office if you have questions about any of these would be Loretta. If someone could put her email in the chat. So I'm going to go over the operational profile, the annual operating revenue, key performance measures, visit data, the student satisfaction survey, and the mental health expansion grant. And so, as I said before, one of the things that the site coordinator does is make sure that our office receives all these. So the operational profile, this is what it looks like online. And this is a way that our program ensures that every school-based health center is meeting the standards of certification. So it's an online data system that is filled out, and each site coordinator and mental health agency receives unique logins and passwords to get access to their school-based health centers. And you'll see in this tab, the blue line across the top. This is different tabs where a school-based health center documents details about the school-based health center, operations, the staff that work there, their shift hours, the services provided, waivers are put in, KPMs are put in, which are the key performance measures, and then the annual financial data. Next. And so when is it required to be filled out? So anytime a new school-based health center becomes certified, they get access to the operational profile and fill it out at initial certification. And then every year there's a deadline of October 1st to fill it out for the new school year. This year that deadline has been postponed to December 1st, just mainly because of the pandemic and impacts. And then we ask that it's checked before a site visit and updated to make sure it's all accurate. So Rebecca and I have the accurate information. And then we ask that anytime there's changes that occur during the school year, that it be updated. So if you have staffing changes, to go in and take out staff and put new staff in. Next. So our program has an operational profiles user's guide. This is posted online for anyone to use. It has instructions on how to fill out the operational profile step by step. And just to bring it to people's attention, it's really important to follow the instructions in the manual on how to delete staff from your school-based health center. And our office offers a training annually. It's usually in September on how to use the operational profile. Next. So another data requirement is the annual operating revenue. So you're required to submit revenue as part of your October 1st operational profile submission. And it's retrospective data from the previous service year. So the last July through June 30th gets entered in that following October 1st. And the due date again for this has been extended to December 1st this year. Next. Key performance measures. So school-based health centers are required to work to improve clinical practice around 3 areas. One is the well visit, and that's for ages 5 to 21, a well visit annually. The second is a comprehensive health assessment annually for that same age group, 5 to 21. And the last key performance measure that we ask people to work to improve is what we call an optional measure. And so the optional measures currently are the adolescent immunization, adolescent teen series, chlamydia screening, depression screening, flu immunization, HPV immunization, nutrition screening, and substance use screening. And then all staff in your school-based health center should be working to raise these measures. These are mostly primary care measures, but for example, in mental health, if you have a mental health visit, those providers should be asking clients if they've received their annual well visit, and then helping refer those students over into the primary care side of your clinic so that everyone's integrated and on the same page and receiving the best care possible.
That can be tricky sometimes, just putting it out there.
Yep. Next. So key performance measures are also reported annually. School-based health centers are required to do a random chart audit, and any physical health, mental health, or oral health visit is for which the school-based health center currently submits data to our office would be eligible for the chart audit. And there are guidance documents for each KPM on our website. And again, this year, the due date for KPMs has been extended to December 1st. Next. So another data element is the actual visit and encounter data. So the standards require that certified school-based health centers report all visits that occur at your school-based health center. So, and they also apply to all services. So that's physical health, behavioral health, and oral health. Any visit that's provided on site at the school-based health center and regardless of the age of the client. And what do we do with this data? We often take the data and format it in a manner that sites can use, either maybe to market themselves or apply for grants outside of our office, or present information to their community partners on how the school-based health center is impacting things. Next. And so when is visit and encounter data due to our office? For all clients, it must be submitted by January 15th and July 15th of every year. So the data that's reported in January 15th, so we have a data deadline coming up, would include all the visits from July 1st through December 31st of this year. And then next summer, July 15th, those visits to be reported would be from July 1st through June 30th. And then data needs to come to our office in a secure format, compliant with HIPAA. Next. Another data element is the student satisfaction survey. So all certified school-based health centers are required to administer a student satisfaction survey that is developed by our office. The purpose of the survey is to get a youth's opinion on the services they've received in the school-based health center, and most clinics administer this survey on an iPad. The survey is only for students ages 12 to 19, and that also means that no parents or guardians are to fill out the survey. And also, please don't administer the survey multiple times to the same client. They should only fill out the survey once every school year. Next. And so when are those to be submitted to our office? At least twice annually. Typically, it's January 15th and June 30th of the year. This year, because of a delay on our end, we haven't even sent out the survey yet to sites. So that January 15th deadline won't apply. The survey will probably go out in January itself.
So I have a quick question here, just to clarify, again, for me. I know that we provide the surveys for any visits with the medical director once a school calendar year. And provide also for those with the visits with the behavioral health clinician. And that's all, right? We don't use nursing visits for that.
It can be any student that's receiving care at your school-based health center.
So nurses visits as well?
It could be, yeah.
Okay, because the nurses do so much, right? They're there more, and they're doing a lot of work that outside of the medical visits. So I'm happy to hear that. because students have, I think, closer relationship with the nurses than they do with the providers because they're there more often. Thank you.
Next. And this long text is language about the satisfaction survey. So we ask that you put this text in a visible location in your school-based health center or online or in materials that you distribute to parents, but basically you're notifying parents that students are offered a survey in this clinic. And we have this verbiage on our website that you can copy. We have it in English and in Spanish. Next. And then the last data thing I'll talk about is the mental health expansion grant. So we said earlier that there are 65 school-based health centers that receive mental health expansion grant funding from our office. Those school-based health centers are required to submit a grant report in January and July of every year that talks about what they've been doing with the funding that we've been giving them, either for the capacity grants or for the youth-led grants. Next. So I went over a lot about certification and a lot about data. They could each be their own presentation amongst themselves. There's a lot of information packed into one orientation here, but are there any questions?
Karen, this is Loretta. I just wanted to comment about a few points. Karen mentioned that typically the operational profile training occurs in September. Don't worry, you didn't miss it this year. I wasn't able to hold it in September, and we decided to go entirely with sending out. I'll be sending out PowerPoint presentation and PDFs, and then also recording a couple of short videos to try to break down and simplify some of the things that I would have presented at the 90-minute webinar. And one of those videos will be just about the financial and revenue entries, since oftentimes the fiscal person is submitting that information into the operational profile. And then there will be one just on KPMs, since that I think is one of the trickiest data requirements that I field the most questions on. And then also one about entering all of the other information into the OP. I'm going to do my best to make those brief. I'm a fast talker, which I think in that circumstance will work out well. So it doesn't take up too much of folks' time. And so my goal is to get those out in the next week and a half or so. I'm finally finishing up the PowerPoints. There's a lot of information to present to you all about that. So be patient and stay tuned. I'll be sending those out. The other thing that I wanted to mention is when Karen talked about how outside mental health agencies have a separate login to the operational profile. Currently, their login only gives them access to enter financial revenue each year, and they don't have access to the staff section, the shift hours, or anything like that of the operational profile. It's really important for the coordinator to touch base with the mental health agency, get all of the pertinent details for the staff. That includes their email address, their licensure, whether or not they're like an LCSW, an LPC, licensed practicing counselor, I think. And we also are asking this year in the OP about, for all staff members that work on site, whether or not they speak a language other than English. So it's another reason to really closely work with the mental health agency to find out that information. And again, that is the coordinator's responsibility. I do have separate manuals for the mental health revenue entry, and it talks about how the outside mental health agency will get login information for the operational profile from our office. So I just wanted to—
Loretta, just a quick question there, because you said something that you just made my day. So I can just, because right now I enter everything for everybody all the time and has been for years, but I really would like to turn over the financials to our, financial director to fill out. But so she doesn't get lost, the other stuff that she doesn't need to go in.
Yeah.
So her view will be only the financials, right?
Okay, so thank you for asking that question, Ceci, because whoever has the login to enter in the mental health revenue, they will be the only ones able to see that mental health revenue. So if a medical sponsor also has the mental health providers working in the clinic, then we try to contain the login just to the same login that you would use, Ceci. So it would be your same login. That separate login is really to, like you said, to try to kind of make it a little less confusing for mental health. But in your circumstance, if a mental health, if they entered in the mental health revenue using a different login, you couldn't see that revenue. And so that's not great circumstance.
Right.
And I have had folks say to me, a coordinator say, well, I'm in the operational profile. I don't see that they've created a mental health revenue entry. Are they delinquent in that? And I don't expect the coordinator to track the outside mental health agency revenue entry. That is entirely on our office. And so we will work with them, and folks really do a great job of getting the revenue entries in a timely fashion. So it's not very often.
In our case, it's one and the same, right? With our
Yes.
sponsor does both. So
Yes.
it's one login.
Correct.
Okay.
Yeah. Okay. Sorry for taking up so much time, Karen and Rebecca.
Right.
I would maybe just to put a bow on this section and kind of underscore what Loretta, you're saying, and Karen and Rebecca, just to underscore that we understand and you all know that this is not a typical year. This is not typical circumstances that we're operating under. So our office, we really appreciate feedback that you share with us. We're trying to be flexible with timelines. You all are operating with reduced capacity. We're also operating with reduced capacity. So things are just kind of not normal, and we're all kind of working together to figure out what would be best. And so I think that was really reflected, Karen, in what you shared with, and Loretta, with how our deadlines are kind of shifting, and someday hopefully we'll be moving back to business as usual, maybe not, but this year is a little funky. So we appreciate you kind of sharing feedback with us and bearing with us as those deadlines and resources kind of shift around.
And real quick, I will say, if you're in an absolute panic about getting KPMs, operational profile, financial revenue entries done by December 1st, please reach out to our office. I can't emphasize that enough.
Yeah, and I think I heard at another meeting this week with you guys that because of all of that, short-staffed and some concerns from the schools in different ways here, that our KPMs, I have the front office staff at all the clinics. We're compiling with the nurses and turning in a monthly KPMs to me. So I'm keeping tabs of what's going on at each of the sites and know what, if we need to make adjustments to be sure that we're compliant. But there has been raised some concerns from the people in the clinics, my staff, that what happens if we're not able to get the 60% in, because it's kind of crazy right now.
Yeah, so we don't have benchmarks for the KPMs. We didn't have them for the data for visits for last year. So the data you're going to be submitting by December, this winter, or not winter, but by December 1st, we don't have those benchmarks. And we also have remove those benchmarks for this service year as well. So when you go to submit next year, next October 1st, like Kate said, hopefully, those benchmarks won't be held. So you will not be submitting waivers for
Okay, that's what I want to know.
compliance.
Okay.
You also
it was
won't have
too,
to,
yeah,
I know everybody is still working really hard
yes,
to
right,
perform the services, and we totally
Right.
understand that. And also, one real quick point, there aren't waivers required for not completing enough satisfaction surveys either. Again, recognizing the times that we're in, we really want you desperately to try to complete the number of surveys
Yeah.
that we're going to ask you to complete. But again, the numbers, just like last year, the required sample sizes are going to be much smaller than
Reduced.
they typically would be. So we're
Okay.
still maintaining that like we did last year.
Perfect. Thank you very much.
Sure.
Next slide, if we're ready to go on. This is Rebecca's section.
Okay. All right. Hello again. So let's move away from data and certification and discuss what makes your clinic valuable to youth. As we've talked about, SBHCs are on school ground because you all know how important it is to be where youth are. According to the Society for Adolescent Health and Medicine, youth-centered SBHCs provide the following: availability, quality, confidentiality, affordability, visibility, flexibility, and coordination. The following slides are examples of how SBHCs are putting these criteria into practice. And as we go through the slides, I will have some questions for you to ask yourself about your particular SBHCs. It is important that all youth feel welcome in the SBHC. So does your SBHC ensure access to culturally and linguistically appropriate services? Ensure that all staff that interact with students from the front of the SBHC to the back have access to trainings, including trauma-informed care? Are spaces designed using trauma-informed practices? And how does the SBHC accommodate no-shows and late arrivals? Next slide. Do youth see themselves in the SBHC? Do the brochures, posters, and staff reflect the community? And do paperwork, workflows, and spaces allow youth to express and document their gender identity and sexual orientation? Next slide. Are spaces and signs identified in ways that are inclusive? Next slide. Does the SBHC communicate appointment reminders and updates to care in ways that youth will respond by text, etc.? Next slide. Do you have ways to reach youth on platforms frequently used by youth? So this is what is this, an Instagram? I can't see it. Next slide. Are hours clearly posted and appointments available at times so students don't have to miss class? Next slide. Websites increase visibility to students, parents, and school personnel. Many of the websites discuss eligibility, and this one shows how the SBHC is affordable and accessible. Is information available and easy to access on your school and district website? Next slide. Is your website easy to navigate and eye-catching? Next slide. So confidentiality is key to providing services to youth, especially in SBHCs where HIPAA and FERPA can confuse the work. Are confidential services clearly defined, and is information available to clients? Does your SBHC have policies and workflows to ensure EOB suppression for confidential visits? Next slide.
Rebecca, are those posters and things from the state available to us to share with us? Or?
That's a good question. I think we had those at some point. Does anybody on the team know?
We did have,
yeah,
we did have them at some point. They were a OHA publication. We are not currently in our office, so we could go check and see. We may still have some. They were also done in part with, in partnership with the state reproductive health program. So we could maybe touch base with them and see if we could get copies if you're interested.
Yes, English and Spanish, that would be great.
Okay, great.
Great.
Thank you.
We will look for those. Okay, next slide. Yeah, there. Our space is set up to ensure confidentiality. Here are some cards you can use at check-in to choose the nature of the visit without letting others in the waiting area hear. Next slide. Some SBHCs serve the community, and having a separate entrance, lobby, and hallway is one way to help students feel the spaces may provide more confidentiality. Obviously, that's not possible for many sites, but if you're thinking about a new SBHC, this is a good plan. Next slide. Yeah. So Oregon law allows for youth to consent for the following services. At 15 years or older, medical and oral health services, 14 years and older for outpatient mental health, drug and alcohol treatment, outpatient mental health care and drug and alcohol treatment. And at any age for birth control related information and services, as well as testing and treatment for sexually transmitted infections, including HIV. Are Oregon's minors' rights clearly displayed and accessible in your SBHC? Next slide. Does your SBHC have policies in place to ensure informed consent? It is important for youth to have an active role in this process. Next slide. So there is so much on this topic, and we have great photos from SBHCs across the state. Here are just a few that represent youth-centered spaces in some of the clinics. Is there a process in your SBHC that allows for youth to help design these spaces and provide feedback? So here's a lobby. Next slide. So this is in an elementary school in Jackson County. Next slide. Oh, I think that's the same lobby I had up there. Anyway, here's also a lobby. So this is a mental health therapist's room, and I have heard many times that when youth are designing spaces, they love twinkle lights. So here are your twinkle lights. Next slide. And this is art. Oh, wait. Yep, there. This is artwork by youth on the outside of the building. And next slide. Okay. So a little bit about YACs. So YACs are youth action councils or youth advisory councils. Next slide. So what are YACs? They are basically youth-driven groups that focus on advising, supporting, and advocating for SBHCs and their services. Approximately half of the SBHCs in Oregon have a YAC. Some are supported by SBHC staff, and others are funded by various grants available. Next, yeah. We know that amazing youth-led work and youth adult partnerships are happening in SBHC schools and communities across the state. And we will extend any relevant youth-led project training and technical assistance opportunities to the SBHC field at large. And I also want to mention that the Oregon State School-Based Health Alliance does work with youth and YACs, and they are another resource available here in Oregon. And maybe if somebody from there wants to go ahead and maybe put your website in the chat, that would be super helpful. And a great use source around youth and SBHCs in general is also the Adolescent Health Initiative. And I think that, yeah, there's their website, and they have an assessment tool on there that helps you realize whether your space is youth-centered. Questions? Great. And I think Karen is up again.
Okay, I'm going to talk about various resources that our office has to help your school-based health center, your site coordinator, help compliance with standards, whatever. So we'll run through some of the resources. So the first one is I wanted to talk about our email lists that our office maintains. We have several email lists, and most of these are built off the information that you provide us in the operational profile. Most all.
Is that available on the ops profile? It used to be, but I don't think I've seen it lately.
What do you mean what's available?
The list of contact people for all other sites.
I've sent that out in the past. I don't know if that's something we've done recently, but it is generated by what you put into the operational profile. That's what you mean? Yeah,
it used to have a tab that in the operations profile with everybody's contact that we could just go in there, and it would say what they could be contact for due to their expertise at whatever topic it was.
I remember that. That was a few years ago, and I think we decided not to maintain it because of staff turnover. And so if you ever have someone that you want to contact in another school-based health center, you're welcome to talk to Rebecca or anyone on our team about, what you're looking for, and we can kind of head you in the right direction of some options of people to contact. But we figured it was too hard to maintain. It was really difficult.
And sorry, just to add really quickly, the Oregon School-Based Health Alliance does operate a Basecamp site, which maybe, I don't know, in the chat could share some information. And that's another informal way to connect with other coordinators and SBHC staff around the state.
Yeah, I'm on that one. I'm finding that not everybody's on it. So it's not really doing what I was hoping, but thank you. Yes, I'm aware of that.
So the emails that we send out from our office, most all of the emails we send are to the site coordinators and site administrators. And we expect site coordinators to take those emails, read them, and then forward them to who they feel is appropriate within their school-based health center. And then we also have email lists that we send information out to. Typically, when we send out an email, it says in the 2-line in the actual body of the email who we're actually sending the email to. So we can send them to health department primary contacts, mental health primary contacts, mental health expansion grantees, youth-led grantees, or the school health state planning grantees are the emails that we maintain a list for. Next slide. So you've heard from Rebecca and I today. We're the 2 public health nurses on the school-based health center team. And we ask that the site coordinators use both of us as your first and foremost way to get questions answered or to contact the school-based health center. You can find this map on our website. This is how we divide the school-based health centers up between the 2 of us. And you can see Rebecca has the green area and I have the blue area. Next. So we maintain our website, healthoregon.org/SBHC, and you can find all this information that we've talked about today on our website. We keep it up to date. The second resource is we have a team email address. It's sbhc.program. And if you can't reach Rebecca or I, or if you want to email the entire team with a question, all of us on the team receive emails when they come to this address. And then we decide who's the most appropriate person to respond. Next. This is one of the landing pages of our website. And I wanted to show you the left-hand column circled in red. This is how you navigate our website. And so it takes you to different tabs, whether it's the certification standards, data, funding. You can find the meeting today will be under training and presentations. And so those are the key tabs of what we maintain. Next. You can find on our website this handout, and we wanted to highlight it because it's useful. What it basically does is on the first page, it takes the school year and lists all the due dates things are due and puts it in chronological order so that you can kind of walk through the school year as you're going and check off where you're at and what's coming up. And on the back side of it is a checklist to prepare for a site visit. So if you know you have a site visit coming up, you can go through that checklist. Next. So we talked a lot about data. We've talked a lot about youth-led work, primary care, behavioral health. And what we do with all the information during the school year is we gather it all and we do a publication once a year that we call the status report. And then every other year we do a more smaller update, but they look the same, except for one's larger, one's smaller. And we publish this, we do it electronically, and we send this annual report about school-based health centers to every school nurse in Oregon, every school principal, every superintendent, every school-based health center, and to all the partners that we typically have connections with.
You send it electronically, right, Karen? No
Yeah,
longer.
we used to do published hard copies, but we've
Yeah.
gone to doing electronic.
Okay.
So you received it last, probably in February, maybe it was last year, this last winter. And then typically we try and get it out in January, try to. But it's a great resource because it
Yes.
compiles all the stories, all the great work that people are doing. We highlight topics that are important for that last school year. So the last one we highlighted some COVID stuff and telehealth. And it's a great way you can spread word about your school-based health center. You can take the report and make sure that your community partners have that kind of information, or you can use the data that's compiled in it to apply for grants for extra funding for your sites.
So SPO is sending it to the superintendents. And
Yes, we send it through ODE and they send it to all the principals and superintendents. We send
perfect.
it, yeah, we send it to the school nurse consultant and she sends it out to the school nurse listserv.
Okay.
Next. Fact sheets. So we take all the data that is sent to our office and what do we do with it? One of the things we do is we make fact sheets. This takes not only your data from your school-based health center, but it takes some information from the Department of Education on school indicators. And it also takes information you've submitted into the operational profile. And we make a fact sheet for state level data so you can compare yourself to the state level. And then we send you one that's specific to each of your school-based health centers. And we send these out annually to the site coordinator, usually by the end of the calendar year. Next. So we have brochures about school-based health centers. They're posted online on our website if you want digital copies. We also have hard copies. They come in English and in Spanish, and they're fold-out flyers, so they're about 3x5 size. And you can use them at community fairs, events you hold, school board meetings, waiting rooms, whatever, however you want to communicate what is a school-based health center. We have created these to be extremely basic. So they talk about what's a school-based health center, how can a school-based health center help, who can go, why would someone go, and what about payment? And so the answers we feel are extremely basic and would apply to every school-based health center in Oregon. And if you want hard copies, you can email Kwang or that school-based health center team email or the nurse, and we can mail you copies. Next. And then on our website, we post all our coordinator meetings. So we hold a site coordinator meeting every October. It usually is in person, the last 2 years not. And then we hold a winter webinar and a spring webinar. So the winter one, I think will be in January this year. And the spring one is usually like around April-ish. We post all our webinars and record all our webinars and post them. So the coordinator meetings you can find on a tab on our website. And then any trainings like this one, we also post online on our website. Next, so we've gone over a lot of information, but I did want to kind of highlight the calendar of important dates. So July 15th is at the top. That's for data reporting and mental health grant reporting. So you've already done that in the summer. October, we already held the coordinators webinar. This year we have December 1st, which is coming up next for some of the operational profile and data deadlines. Then we'll hold a winter coordinator meeting. And then January, there's a big deadline for some data coming due, a spring webinar, and then in June, the satisfaction surveys are due. Next. And this is our contact info. We work as a team, we collaborate a lot together. We're always in communication with each other. We're responsive when you reach out. And so please do reach out. Any question, any concern, anything you want to bounce ideas off of. We're definitely a resource here for you because we want youth to be served, youth to be healthy, and to have a strong school-based health center model. Next. So any questions? That's the end of our presentation. I know we've gone through a lot of information. I think each section could have been its own orientation in and of itself, but we want to give everyone a highlight of what school-based health centers are all about, what makes them youth-focused. Are there any questions in the chat, or does anyone want to unmute and ask questions?
Yeah, this is Paul Erlebach, Neoconi School District Superintendent, and probably one of the most recent school-based health centers in Oregon. I would just like to publicly recognize Karen and Mike and Kate for all the assistance provided to a school district and a health provider starting the process and establishing a school-based health center. It was very easy. Without your help, it would have been, well, it wouldn't have been possible. So we do appreciate, and hopefully the other school districts considering opening a center will understand that it's an easy process.
Thank you, Paul. So Paul's from Tillamook County, Neoconi School District, a rural community, and they had one of our planning grants. And they've done remarkable work with Reinhardt as their medical sponsor to open up a school-based health center. So if anyone wants to open someone, I would definitely refer them to Paul and Gail. They've worked really good as a school district working with the medical sponsor to really do a lot of great joint work. And they've done really good work with involving youth from the get-go.
And bravo for superintendent to show up here. I wish, I would love to chat with you, Paul, at some point to find out more about the language that we should be using to get our superintendents to be as involved in as you are. So,
Yes, I would be more than willing to talk with anyone.
thank you.
Any other questions? Well, if anyone doesn't have questions, people can always reach out. We're going to end early and give you back some time. But we definitely want to thank everyone for coming here together. I know it's been a wide selection of people that have attended different roles. And I know it's a lot of information to go over.
Thank you, ladies, once again. This was awesome. Thank you. And
yeah, thank you, everyone. Goodbye.
Thanks, everyone.